So our future webinar topics will be May 14th, where we will be discussing lung function testing, June 11th, which is asthma medications, and in July, we will talk about healthy homes and how that correlates with asthma and asthma symptoms. And our last one will be in August, and we are still deciding what that topic is going to be. Having a little technical difficulty here. So the Asthma Management Academy, we also have a Facebook page. So those of you who are linked to Facebook, please like our Facebook page and begin to follow us. We often post articles and give information about upcoming webinars or trainings happening in Southern California. Pregnancy and asthma, clinical subject matter, our Dr. Marilyn Li, she is, she's not available right now. So we are going to skip this slide and we're waiting for her to log on. So we are going to move backwards in our presentation with starting with our community health worker subject matter experts, which would be Consuelo Pernia and Maria Bejarano. We want to give Dr. Li a little bit more time to get on because, as we know, doctor schedules can change abruptly, and she needs a little bit more time to get on the presentation. So thank you for your understanding and your patience. We are doing our best to navigate through this unforeseen circumstance. So here at Esperanza Community Housing, we do a lot of work within the community. We have different programs, and one of our programs is the Healthy Breathing Program. Two of our senior asthma specialists are Maria Bejarano and Consuelo Pernia. Maria, she has been working in the community for 22 years. She graduated from the Promotora de Salud program here at Esperanza in 1996, and she has been working specifically in healthy homes and asthma for 19 years. Consuelo Pernia graduated from our Promotora program in 2002 and has been working in asthma for 17 years. Next slide, please.
Hi, good morning, everybody. I am Consuelo. I will share with you my experience in a visit made to a pregnant woman. This woman was 32-year-old pregnant woman with an asthma diagnosis. During the baseline visit, she was in the third trimester of pregnancy. Her asthma was not under control because she was having asthma symptoms frequently, especially at night, and for that she was using the albuterol more of the time per week. But she had also prescription for Pulmicort, that is a controlled medication, and she told me that she never took it because she was afraid of the effect on her unborn baby. Furthermore, she told that she didn't regularly attend the prenatal checkup recommended by the doctor. Also, in the assessment that I made in the home, she had a lot of triggers in her home, as roads, moles, dogs, and pets, one dog. During the follow-up visit that I made to her, she informed me that her child was born premature. She had one premature child. And when the basket that I found was Next,
Next slide, please.
next slide, please. The barrier that I found were lack of education about medication for asthma and use of it, lack of education about how to avoid or eliminate triggers, didn't attend prenatal consult with a doctor, which her doctor recommended to her. And the recommendation and education, next slide, please. Talk about the risk of not. I talked to her about the risk of not taking the medication that the doctor prescribed and talk with your doctor about the importance of this medication, specifically the steroid inhaler that she didn't want to take. The second, the risk that you and your born baby have if you don't take the asthma medication. I recommended to her, this is very, very, very important for her and for her unborn baby. Go to her scheduled prenatal visit because it's very important working closely with your medical provider to monitor your asthma symptoms and make change to your asthma treatment plan as needed. The other thing was how to reduce, eliminate, or avoid the triggers that are in her home. This is very important. And the other thing, obtain asthma action plan. This is very important. How to take correctly the medication. Another thing that I found was that she needed support for her family. This is very important too for her. Okay.
Thank you, Consuelo, for sharing your experience and how you have been able to successfully help some of the clients within our community that who are pregnant and who have asthma. Next, we are going to invite Maria Bejarano to share some of her findings and the way that she is able to mitigate some of the issues that she finds with pregnant women with asthma in the community.
Hi, guys. This is Maria. I'm going to share my experience working with pregnant lady. When I conducted the first visit, the lady was around 25 years old with 3 months of pregnant. She has a 2-year-old daughter. During my visit, she was coughing most of the time. I asked her if she has asthma medication. She said that her doctor prescribed her a reliever medication, albuterol, and controller medication, Pulmicort. She told me that she only was taking the albuterol because she was afraid about the controller medication, Pulmicort. She was afraid about the steroid. She said that she does not want to put in diet to her unborn baby. I explained her the asthma medication, the reliever and the controller medication, and how they work in the airway, but especially the Pulmicort. This is a controller medication. I told her that her doctor prescribed this kind of medication because it's safe to use them, and she needs to have her asthma under control. I encouraged her to ask her doctor, OB/GYN, or any concern or doubt that she has about medication. She says she does not understand because her doctor only speaks English. I encourage her to ask for interpreter.
Next slide, please.
Some of the barriers I found fear of medication use while pregnant. Most of the people have this fear for this use medication, fear and addiction to medication. I hear many people that say, oh, my son is going to be addicted to the medication. Lack of education about triggers that worse asthma symptoms, especially roche and mold. Some of them have roaches, but they don't know that this affects the asthma. And language while interacting with doctors. because this person just only speaks Spanish. Next. Next, please. The recommendation, talk with her doctor about any concerns about the steroid medication use. Make an appointment with OB and ask them about medication concern as well, because she needs to control her asthma. And recommended that she ask the doctor for an interpreter during visit and to explain medication use. Of course, obtain an asthma action plan. Next, please. The main barriers that are seen with pregnant women with asthma is fear the medication will put unborn child in danger. More pregnant women think about the fear about they put up an unborn child in danger. Difficulty in control the triggers. Some of the mama, most of the time they are depressed or sleeping, so sometimes they don't have time to controlling the trigger, but that's why it's important to integrate the family to help them, to help her. Not going to the prenatal visit, no communication with doctor or other healthcare professional, language, and lack insurance. Thank you.
Thank you, Maria, for sharing some of your experience with working with the pregnant women in the community and really being able to identify those barriers that we often see. Many times these barriers affect pregnant women and non-pregnant women. It's just pregnancy, when in and of itself, begins to add additional barriers and accentuates the experience of asthma with the mother and the child. We would like to extend our deep apologies for not having Dr. Li with us today. We're not quite sure what happened, but we do understand that doctor schedules can change abruptly, and we want to apologize for any inconvenience that this has caused anyone who is able to join us on today. With that being said, we're going to talk a little bit more about the barriers with pregnancy that we see in the community. And one of the main ones that we notice is the lack of family support. Pregnant women in general need additional support. They're experiencing a lot of things, whether it's emotional, physical, financial, family, things that are affecting them. And with asthma also thrown into the mix of pregnancy, it just begins to add a lot of other challenges in many cases that are really hard to navigate. So one thing that we do as community health workers is we really advocate and really educate the family about what asthma is specifically, and then really talk about how that this can affect this pregnant woman and how she really needs the family to advocate for her, to be educated, to make sure that she's getting the access that she needs to medical care, and to do their part as the community, as the family that is directly tied to this woman. So when we do home visits, we often do education with the family. We encourage her to have the partner there, her mother there, her children there, whatever her strongest support system is, so that we're able to provide that education for them as well. And we have found that this is a successful model that educates the family about asthma, but also empowers them to be able to do their best to make sure that they are creating the ease for her to be able to manage carrying this child as well as her chronic condition. And we're going to have Consuelo. She wants to add more to this particular topic.
Okay. I got to say one thing. It's very important for the pregnant women, three things: medication for her control of his asthma, because it's a risk for her and for her newborn baby. Second, control the trigger that they have at home. And third, the follow-up for the doctor. That is very, very, very important for them and for the newborn baby.
And so, Consuelo, can you talk a little bit more about how you encourage your pregnant clients to control their triggers that they have in their home?
Okay. In our BC, we encourage her or them to have control of the trigger at home because they are very, very important. We teach to them how to fight against them. For example, if they have mold, we teach to them how to clean perfectly the mold, no using never bleach, vinegar, baking soda, or it is okay. For example, in the visit that I made to this pregnant woman, she has pets. Sometimes they love too much the pets. In this case, if you don't want to take care of the home, the pet, you have to take very careful, take a bath every week, and go to the veterinarian with the pets. If you want, and it is very important for her and for another people with asthma, if they have pets, make allergic test, a skin allergic test. This is very important. I think so.
Thank you, Consuelo. So, yes, we definitely accentuate the necessity of an allergy test. If they do have pets, but they are extremely attached to the pets, really encourage them to bathe the pet regularly. Don't keep the pet in your room. Don't sleep with the pet. Keep it out of your bed. If they just do not want to have that pet outside, we get the allergy test. See if there's any medication that you can take that can help with the buildup of antihistamines and other things that are happening in the body. Excuse me. Being connected to medication is very important, having that open dialogue with the doctor to make sure you're taking the proper medication, that you're using the inhaler properly, discussing the concerns about steroids, never being afraid to have these communications and these conversations with your physician. So we find a lot of times that our clients are afraid to bring up their questions. They are afraid to have these conversations with their doctors for the fear of being looked at as ignorant or talked down upon. So they often keep their questions to themselves. But we give them, we empower them and we encourage them to have these conversations because it is very important whether you're pregnant or not, but even more important when you are carrying an unborn life.
So, Maria, can you talk a little bit about, I know a lot of our clients are often nervous about taking asthma medication. Can you talk a little bit about how you respond, especially when you're working with a pregnant woman, because their fear is a little bit more specific, right? So their fear is more my unborn child is going to be affected by this medication use rather than just it's a steroid and I don't want to be taking a steroid. Can you talk a little bit about how you would talk to a client if they have that fear?
When I talk with a client that what they are afraid about the steroid, I told them don't be afraid, don't be fear about the steroid. The steroid is doctors say that it's very secure to use it, and it's better to have the asthma under control because if the asthma is not under control, they can have some consequence. The unborn baby can born with premature and also low weight. So I encourage them to take the medication, and I ask any question about the medication to the doctor or physician because this is important that they understand that the medication is secure and they need to take it because they need to have the asthma under control.
Thank you, Maria, for adding that. We would like to invite any of you who may have questions to the community for the community health workers, and we would do our best to answer them. We have one question in the box that says, how do we get doctors to use the interpreter service that they have available when they see their patients? How do we get doctors to use the interpreter services that they have available when they see their patient?
In respect to that, in every clinic they have interpreted for Spanish. It's by law. They have interpreted in Spanish or maybe in another language. This is very important that the client understand clearly the orientation of the doctor. This is very important. It's the right of the patient. It is the right of the patient.
So one thing that we do is we, again, empower and let our clients know that this service is available and for them to request it and to know that it is their right to have this service and that they should continue to ask for it until they receive it.
Sometimes they don't have available an interpreter in the clinic or the hospital, but they call to, probably it's a center, any centro?
They have a center.
A center that they have a bilingual interpreter, so they call by phone. This is the way that they use the interpreter.
Thank you, Maria. So there were also some questions that were posed during the registration. So we're going to take a minute and answer some of those. So the first one we're gonna talk about is if the mother has asthma, will the newborn baby have it too? Maria, Consuelo?
Sometimes if they don't have the asthma under control, probably the unborn baby can born with a respiratory problem.
I think about that. As you know, asthma is a genetic condition. They have the heredity of asthma, but not necessary that the baby has asthma too. Not necessary, but the baby has a high risk to have asthma if the mom has asthma.
So we have another question, so in this case, they would also have to check with their primary care provider and ask them while they're pregnant about asthma. So we have another question, so asking for resources to provide to pregnant clients that have asthma that might not have insurance. So we can talk specifically about California. If we have national participants that are not in California, that would be a question that you can look up for your state specifically. May we respond to resources?
If we find a person that they don't have a medical insurance, we refer to the resources that we have. In our organization, we have a person who is in charge about the medical. We refer to her to when we find people who doesn't have insurance.
And there are different clinics that will take patients that don't have insurance, and that's just a local resource that you'll have to look up on your own. We have the BreathMobile is one that we refer to, and then local clinics that have either sliding scale features or resources that they can use if a patient is pregnant and does not have insurance.
And here in California, we have maternal child care health access, and then we also have Medi-Cal. And so Medi-Cal does have medical insurance for pregnant women. They do insure pregnant women specifically. It is based on income, but the income threshold is higher than most people think, and they will provide health insurance for many of our California residents who are pregnant. We have another question that says, Does the use of steroids reduce the possibility of baby having asthma? So that would be a Dr. Li question, and we can refer that to her to answer. And once we receive an answer, we will send that in an email to all of those who have participated.
So next slide. So if anyone else has any questions, please put it in the chat box. If not, the contact information for Consuelo, Maria, and Arden Caffrey is on the board. Feel free to email any of us at any time if you have any questions, and we can also respond to the questions that you have that we couldn't answer later once we get in contact with Dr. Li.
And again, we would like to offer our formal apology for this particular situation that happened with the webinar. I'm sure Dr. Li has something that came up that she just could not avoid. And so thank you for your patience. Thank you for cooperating with us and hanging on with us as we powered through this presentation. This wasn't what we expected to happen, but we thank you for your cooperation and your participation.
All the slides will be available, including Dr. Li's slides, once the presentation is over. So you will get a link to that, and they'll also be on the Asthma Management Academy YouTube channel, which the link is on the next slide, I believe. And you can read through Dr. Li's slides in that. Thank you very much, everyone. And we will have our next webinar on lung function testing. Our subject matter experts will be Northeast Valley Health Center, and that will be on Tuesday, the second Tuesday in May. At 11 a.m. at the same time. Thanks everyone for your patience and your understanding, and we are excited to continue to give the Asthma Management Academy webinar series throughout 2019, and we welcome any questions that you have at our emails that were provided.